So we're going to open it up to Q&A. I know Liz has been tracking questions in the chat box. I've seen a number come in. So Liz, if you want to go ahead and get started throwing out a question that's been posed.
Yeah, sure. So hello, everyone. I'm Liz Salmi. I'm the Senior Strategist for Research Dissemination for Open Notes, and I've been in the chat box off to the side and keeping track of your questions. And I'll ask a few, and then I think Amanda sometimes unmutes people, and so you can verbally ask questions as well. So first few questions will be for Dr. Bourgeois, sorry, Fabienne. First question is from Janine Benjamins, who asks, to whom are confidential notes visible?
So at this point, the confidential notes are just available to any provider in the electronic health record. We're not able right now to send it differentially to either a parent or an adolescent, depending on what content of confidential information is. It is absolutely part of our dream is to at some point be able to also send the confidential visit to the appropriate person, but right now it's really just available to the providers within our organization.
Got it. But patients or parents can still do a medical records request and ask for any information they don't see. Is that correct? Yes
and no. So again, as it pertains to some of the adolescent confidentiality, is not released to the parents.
Got it. Okay.
Even through medical records. Yep.
Got it. Thank you. Non-pediatrician here, so that's really helpful. Another question is from M. Cran, who asks, is the confidential notes only restricted to note types or transcriptions, or are they also associated with labs, radiology tests, microbiology, etc.?
Yeah, so we have a separate process where we flag certain labs and radiology results, problems, et cetera. All of those things can also be flagged confidential. And that information is also from the portal so that the parent of an adolescent cannot access that information. It's at this point, again, similar to the notes, we're also not able to share some of this information with our adolescents, but that is part of our future goal is to be able to differentially be able to send the information to the appropriate person.
Got it. All right, the next question is from Catherine Smith. I'm going to read it as if I imagine I know what her voice sounds like, but she says, I would like to know how the list of expected confidential things was arrived at. I bet we can all think of lots of possible confidential things, but last time I checked, there was no national standard for particularly sensitive information, not much statewide, or is it depending on the state? So how did you come up with that original list?
We based it was a multidisciplinary team within the hospital that included some key stakeholders, including prescribers from high-risk clinics. It included our health information management director, included our legal and compliance team, and myself. And so it was really a group effort to create what we would consider our standard for Boston Children's.
Question is very similar. It was by Khalida, who just also asked, how did you choose what was going to be confidential? How did you know if confidential issues will or won't come up? But like you just said, it sounded like as a group you came to a consensus.
Correct. And then again, right, part of it is also the notes, for instance, we don't know when it's up, which is why we allow the providers the flexibility to choose the appropriate note type.
Got it. Next question is from Shirley Otis Green, who asks, I'm curious if the patients or families notice that some notes are not shared, if they have become accustomed to viewing notes and following appointments. It sounds like Michelle in her presentation kind of talked about this as well. Do you hear about that a lot?
So I will tell you, I was very much expecting to hear from a lot of people for this exact reason, and we were bracing ourselves for how we were going to respond, what we were going to say, et cetera, et cetera. It doesn't, like Michelle, there's some who notice and don't tell us, and probably understand why that occurs, in particular in some of our higher risk clinics. But we actually it hasn't been a problem. We were really expecting it to be an issue that we would have to address, and it just hasn't materialized.
Got it. Kalita asks, do any mental health, social worker, psychologist notes go to the portal?
So from the psychiatry clinic, no. Our psychologists, again, can choose whether or not to send them to the portal. The vast majority of them don't. Again, because confidential information in there, sometimes it's confidential information that's shared by the patient, sometimes by the parent. So those do not. Social work notes do not go to the portal. Those we have systematically excluded.
Great. Then there's a question by Catherine Smith for Michelle, but we might all answer this together, I'm not sure. So Catherine asks, I'd love a clarification of what is meant by a telemedicine note. Does that mean a note emanating from a virtual appointment or another type?
Yes, virtual visit appointment, more a video appointment, I was thinking, but any appointment that would constitute as a virtual visit. So it's hard to differentiate now unless the provider actually writes out that it was a telemedicine visit.
Great. Fabienne, did you have anything you would add on to that? Do your clinicians who handle telemedicine at Boston Children's, do they have access to the EHR, or is there a different system being used in your case?
No, they have access to the EHR. Again, as Phil mentions, right now it's just managed as a typical clinic note with some notation that it is a telemedicine process. But I will say our telemedicine process program in general is evolving, so I'm sure that's going to evolve over time.
Yeah. I noticed different organizations are handling telemedicine in different ways, where sometimes it's contracted out and they might not have access to the system's EHR, and others where they do and they are using their own clinicians. And it sounds like in the case of Boston Children's, that's what you're doing. And so then the note, in theory, should appear in the portal for patients, unless it's checked as don't share.
Exactly, that's correct.
Okay. We had a kind of slight technical question that I know Deb responded to, and I wanted to give her a chance to verbally respond, but I'm not sure if her audio is turned on. But the question is from Benny, who asks, would you know if anyone is using the EHR platform ECW, and can you tell us more about which EHRs are able to share notes? And if Deb's available, I could let her respond.
Hi, can you hear me?
Yes, I can hear you.
Hi. So regarding ECW in particular, been with the version 11 release of their portal, they did implement the ability to share notes, but there was a glitch that when Open Notes was launched, retroactive notes were also notes that were put in the EHR prior to that launch date were shared, which we only know of 2 places in the country across all vendors that we know of that are where sites are sharing notes. We only know of 2 health systems that chose to retroactively share notes. So usually that's not what a health system wants. So what we've heard is that ECW is going to be fixing that glitch. We have not had a confirmation yet that that's happened. But the other vendors that allow the functionality for sharing notes are Epic, Cerner, Meditech, and Allscripts. All 4 of them have had that functionality now for a while.
Thank you. All right, so I'm now back in the chat box and seeing a whole bunch of new questions coming in. And so this is open to anyone that, and maybe you, Fabienne, know for sure, but if there are others on our team, feel free to join in. But the question is from Lena Rubenstein, who asked, has anyone with Open Notes in pediatrics explored allowing information to pass to Apple Health Records app?
Yeah, so it's certainly something we're interested in. We have not. Part of the problem right now with the app is that, for instance, if you are a parent and you have your information flowing into Apple, and then you want to sign in and also have your child's record, it would intermingle with your information. There is no way right now for that information to be separated out. So in other words, to have 2 people's information on one app. And so I know that's something that I'm much aware of and I think exploring. So we would be very interested in doing it at some point when there's a better way of managing as information as a proxy.
Interesting. That is interesting. Then next question, I would love to hear a response also from Michelle and Catherine, if you guys are interested. Sorry, Michelle and Erin, if you're interested. But the question is from Everett Weiss, who asks, how do you manage when a patient knows Open Notes exists, but doesn't see their clinic note in the patient portal, and then ask, why doesn't the note show up?
That's a fabulous question. I've kind of resorted to the fact that adolescent med doesn't. I did question one of the clinicians. They just said that they weren't on the Open Notes. So I'm assuming that that's just a departmental thing. From the sounds of Fabienne, I'm right? Possibly?
Yes, absolutely. Yep, that's exactly it. I mean, to be perfectly honest, and part of the reason we haven't had more of a presence in terms of telling people not to do it is, frankly, we would like these providers to hear that you would like access to these notes, because that will just help us down the line as we're trying to get them on board as well.
And the other one I had actually called the office for. So, because again, it's just pieces of those puzzles that are missing. So I did call and request a copy of that.
Yeah, this is Erin. I would say that's exactly what I do is I call and ask for it. If I call and I ask for it, particularly being an adult patient between a couple of different health systems in the Boston area, like I need those notes. And if I don't see it showing up electronically, I call and bug people until I get a copy some way.
Everyone's getting the tips and tricks. And I'll say, giving a shout out, there are some clinicians who've been doing research around sharing adolescent notes, and do adolescents understand their notes when they read them. There's a new paper coming out of Rady Children's Hospital in San Diego that's going to be in the journal Pediatrics around that topic real soon. So it's not out, otherwise I'd share the link with everyone, but look for it. The co-authors are Dr. Huang and Kelps. That said, back to the questions. This might be for you, Fabienne. S. Fan Xiang asked this question. Do you manage physical rehab therapy notes differently?
No, we don't. Those are shared and shared quite broadly.
Great. This one is from Dolly. Very interesting question. Does the patient ever get to decide if they want a note to go to the portal that the clinician may otherwise have marked as confidential?
Yeah, so again, those could be managed on a case-by-case basis, and that will be one where we have the patient, family, and the provider resolve it. But yes, they can absolutely retrospectively change the note type from confidential to non-confidential, based on what is actually appropriate. That is appropriate, and could certainly then share the note. Great.
Another question is from Jay Firth, who asks, what EMR do you use at Boston Children's? And then says, we have Cerner, and I'm curious if this is an option for us. Also curious, my screen changed. Also curious how you choose if a note goes to the portal, ours automatically populates.
Sure. So we are actually a hybrid system. We have Cerner for our electronic health record, but Epic for our registration and billing system. So our portal is a bit of a hybrid, depending on what part of you're trying to get to. I'm happy actually even offline to go into the technical details of how we did it, and if you would like more of the technical details and information in terms of how to do this within Cerner, we're absolutely happy to share that.
So a question from the Planning and Development Department staff somewhere asks this question. We're wondering if you have ever had a situation where a provider accidentally marked the visit as non-confidential, but had confidential information in the note. If so, how was this handled?
Yeah, so not that we know of. So not something that's gotten to the point where it's either gotten to a provider, gotten to compliance, gotten to us in any way, shape, or form. I will say that I'm certain there probably is a note out there where this happened, probably several. And one of our next projects was to actually try and see whether there is a way in which we would be able to take a look at our notes that are flagged as non-confidential and try and sort out if that happens with some regularity, if there are specific parts of the notes, such as kind of some of the automated templates that pull through like medications and problems, or other certain areas where we're most likely to see that, with the idea then that we would obviously provide some efforts in trying to mitigate some of that problem. But it is not in, 4 years essentially of having open notes, it isn't something that we've often or at all, and certainly has bubbled up to any of us. I will say our providers are really not shy in sharing issues, so I would have expected to hear about it if it had been a significant issue.
Got it. And I know we've got 4 minutes left, and I have 2 more questions I want to read that I'm excited to hear you answer, because these are questions often asked of us at the Open Notes team, and we're like, we don't have all of the answers, but believe it or not. And so this question is from S. Fengxing, who says, are there any resources for clinicians to write notes that are patient-centered and health literacy friendly?
So we've been looking for that as well. I don't think there are a lot of resources. If someone out there would be willing to put something together, I think that is definitely a need. Partly it's some of the information we like to hear from our patients and our families in terms of how we can make this a little bit better. And that definitely is on our next steps. So I think that is an opportunity that would be welcomed by many.
Yes, I will echo that from the Open Notes folks. We set out to research what happens when patients read their notes, and there was all these great benefits involved. And now everybody's asking, okay, well, how do you write the notes? And so far we've been saying, don't change the way you're documenting, because all the research is around documentation as usual. However, we're learning some folks are thinking now that the audience could be different in some way, that it's actual patients. So how might they tweak their notes to be a little more patient friendly, such as writing out acronyms, stuff like that. There is one paper I'm aware of by Dr. Jared Klein. I'm forgetting which publication it is in right now, but maybe we'll throw it in the notes on the recording for YouTube. That said, there is one more question. Last question here is from Betsy Lowe, and she asks, has Boston Children's started to think through a more systemic way to educate teens and young adults on reading their own notes as they enter into
this question, because this is one of my areas of particular interest, and is definitely areas where one of the projects we would really like to engage in the next year or two is really trying to get more of the adolescents involved and really get them more engaged with their notes, because I think this is a huge opportunity. That is really our particular area of interest within our team.
Fantastic. Well, I'll stop asking questions because Amanda might have some things she wants to say to wrap it up.
Yeah, because we'll officially conclude. Thank you so much to our presenters. That was really wonderful, and thank you everyone who joined and for the great discussion. I just want to remind you that we are starting this year-long learning collaborative around pediatrics, adolescent care, and sharing notes within those contexts. If you're interested in being a part of that, if you have ideas about which aspects of this topic we should focus on with this collaborative, please email me. My email address is on the screen. But we'd love to hear from you, and we'd love to have a robust group going around this topic. Thanks everybody for joining. We did record this. We will have the recordings available. We'll send it around to everyone who registered. We'll also send a PDF of the slides, so you'll have my email address there as well. You can reach out to me. That's all from us. So thanks so much for joining, and stay tuned for our next webinar.